When seconds matter, what happens before a patient reaches the hospital can make all the difference.
Welcome to What Brings You In Today, a podcast from SGMC Health.
I'm Kara Hope Rockwell.
And I'm Erica Bennett. And today we're catching up with Emily Brown, Director of Trauma and Emergency Medical Services at SGMC Health. So, Emily, what brings you in today?
Well, we're going to talk about EMS and trauma.
Very good. So Emily was actually one of our first guests when we started episode 3. Mm-hmm. So a lot has changed in those 2 years. A lot has been achieved by your team. So why don't you tell us a little bit about that?
So we are now coming up on our first redesignation for trauma. So we're hitting our 3-year mark as being a level 3 trauma center here, about to have our redesignation visit in the next couple of months. We've done a lot of work in that space, increased our trauma volumes pretty significantly with just, referrals from the region and just the increase in trauma overall in our area, in our community. We have really increased our EMS coverage. We have moved into another county. We've started coverage over in Brooks County. And that's going really well for us. We have added trucks to our fleet. We will stand up our 7th truck in about 30 days. We'll have a new truck to add to our fleet that'll be additional for us. Increased our call volumes, EMS overall. I guess probably one of our biggest things is we've added prehospital blood transfusion capabilities to our service. We have expanded our transport service, our interhospital, interfacility transport services. We've actually grown that division from the ground up. And so we now are running sometimes 4 and 5 full-time trucks, including a critical care truck for that division. So lots of good things, positive things, lots of growth in both of those spaces.
So let's give the listeners just a little bit of background in case they are not familiar with emergency medical services. Here at SGMC Health, they cover Lowndes, Lanier,
Eccles,
and now Brooks. And which is a pretty large, significant geographical region.
Yes.
So a large area covered by what is emergency medical services?
So we cover a little over 1,600 square miles, which is a large area over those 4 counties. Several of those counties are some of the largest counties in the state. But we provide the 911 emergency services coverage to those 4 counties. So if you call 911 for an ambulance, SGMC Health EMS is who's coming. And
what kind of professionals make up EMS?
We have EMT advanced and paramedics in our 911 division, and then we have paramedics, EMT advanced, and EMT basics in our interfacility or specialty care transport division. So advanced EMTs, they go forward after a basic certification, and that's additional schooling. And then a paramedic is you can actually have an associate's degree, paramedic degree. And so we have an EMT advanced and a paramedic partner on each 911 truck. And then for our specialty care, we sometimes will have 2 EMT basics or an EMT advanced and a basic or a paramedic. For our critical care transport truck, we have a critical care credentialed paramedic there. And we have quite a few critical care paramedics within our 911 division as well. And those paramedics have additional education. We send them to University of Florida's critical care paramedic program, and it's about a 3-month program that they do clinicals, additional hours and clinical hours there. And it really focuses on the critical care transport and management of severely injured or sick patients. So we have, I think, about 12 or 14 within our 911 division that are critical care paramedics.
That's awesome. Let's talk a little bit about the pre-hospital blood program that you mentioned. That's something that we recently launched here. What kind of problem were you trying to solve, and what results have we seen from that?
The first 60 minutes after a severe trauma is critical. And in rural Georgia, that 60 minutes is quickly gone by the time you've realized there's an accident, called 911, an ambulance gets there, you take care of the patient on scene, and then you have to get them back to a hospital. Hemorrhage is the leading cause of preventable death in trauma patients. And so it was really important to us for us to be able to bring that life-saving treatment to the scene because it really 20, 30 minutes makes a huge difference for a trauma patient that's hemorrhaging. So this was something that the state has actually been working on for several years. It's not always been within the scope of practice for a paramedic to initiate a blood transfusion, especially on scene. So the state of Georgia Department of Public Health added that into the scope of a paramedic, and they can receive post-licensure training. So it's agency specific. Your paramedics at your agency are trained based on what your agency protocols are. Dr. Seaton, our medical director, wrote those protocols, and we trained them on that so that we could start that service. And so that's been something that we've been waiting to happen and working on for probably about 4 or 5 years. And I think within the last 2 years, maybe a little longer than that, is how long it's been within the scope of practice. So it was a really lengthy process for us. There's a lot of moving parts. Blood has to stay at a certain temperature. And whenever you're mobile, you have to come up with ways to be able to keep that blood at the right temperature. So we have special coolers in our vehicles that have to stay plugged in, and just things like that. It was a lot of moving parts. And so we're proud of that. We're proud to be able to offer that. When you have someone that's had a car accident in Eccles County, on the far side of Eccles County, and then they're way over 60 minutes before you get them to a trauma center. Yeah. So us being able to take that blood to the scene and start that transfusion there sometimes will make a difference between whether that patient survives or not.
And there was another medication also that y'all can distribute on the scene, correct? I can't remember what it's called, but it was
TXA.
Yeah.
So we've carried TXA, I guess, a couple of years. And that medication is also important, and it's not really something that's going to stop the hemorrhage, or replace the blood product immediately. What TXA does is really strengthens, like when your body begins to clot, it strengthens that clot. And so it helps you the clot not to be fragile and break up in the middle of a severe trauma. So we've had that medication for I guess probably about 2-3 years maybe. And we do give that for trauma patients or anybody that's got hemorrhage. We can give that medication and give that en route to the hospital.
Implementation-wise, what did it take to launch that program? I know that we had some trainings with our fellow first responders, and what did that look like?
It took a lot. I guess probably gathering up protocols from other agencies that had already done it. There was Northeast Georgia Health System in Gainesville had already piloted this program. They were the pilot program for the state. And so we worked with them to get their protocols. There were other agencies. We actually were able to go to Atlanta and ride with Grady EMS and their fly cars to be able to see what their process looked like, to learn how to do it. That was interesting. So we did that. A lot of it was just getting the protocols and filtering through what would work for us versus what works for a metropolitan area like Atlanta or Gainesville. So we did that. Buying the cooler and the supplies, that's not cheap. So we had to purchase all of that. We had to find the right cooler. So when it's 100 degrees outside in South Georgia, you've got to make sure that cooler is going to maintain the correct temperature. And we took us a little while to pick the right stuff. But the training was really intense. We actually we bought fake blood products so that they could actually simulate starting the transfusion and working with getting the bags and the equipment set up. And that's really the biggest thing. When you get on scene, you can usually look at a patient and tell that they're going to need that blood But when everything's going on, it's chaotic, everybody's running around, the just being able to recall how to set all that stuff up, it really is, it depends on muscle memory. So the training was important. We trained over 200 personnel, and that included every fire department within Lowndes County was trained. And so they actually carry the setup on their fire apparatuses, and for certain calls, they'll go ahead and have that set up for us when we get there. And then all we have to do is take it, and they help us, our paramedics come and start the blood transfusion. So that takes a lot of time off of how long it takes to get it set up and how long it takes you to get off scene. Our scene times are something we're really proud of here for our level 1 traumas. For patients that have been shot or stabbed, our scene times are like 6 or 7 minutes on average, and that's well below the national average. And we didn't want to do anything that was going to prolong that, because the goal is to get them to the hospital, get them in front of a surgeon. They need to be at the hospital in surgery where there's other resources available. But training all of those personnel to give us the information we need before we get there, to know if we need it, going ahead and getting the setup done, going ahead and being able to start the transfusion as soon as we roll up on scene. That was really important. And we've worked hard with that, and we've done it. We've actually done it several times since we went live with this process, and it works. And so we're proud of that. I'm probably especially proud that when you get on scene, there are agencies. You're looking at 3 or 4 different agencies sometimes, and they all know what to do. We're working on the same protocol. So that takes a lot of work, and we're proud to be able to do that and offer our patients care that you see in metropolitan areas like Atlanta. We do the same thing here.
Yeah, there's several pockets of care that I think about with first responders. You know, you think about the trauma, which we're talking about now, but then you have your heart attacks, you have your strokes, and so much education goes into the first responders to be able to prep those patients before they ever even get to the hospital so that they can have better results. So tell us a little bit about what that looks like in regards to stroke or heart.
Yeah, so all of our fire departments they all have certain calls that they go to, and we ask that they automatically respond to high-risk calls. So your chest pains, your stroke patients, diabetic emergencies, respiratory distress, drownings, any kind of high-risk call, they are automatically dispatched along with us. And their fire departments are so concentrated within an area that the majority of the time they beat us to the scene. And so they're able to go and start that assessment and provide us really critical information to let us know, do we need extra trucks? You know, do we need to step it up and get there a little faster? You know, what needs to happen? They train with us every quarter. So we set up quarterly skills and we focus on different things. So we focus on stroke. Like we talk about that and we go through how to recognize the signs and symptoms of stroke. They all have access to call our emergency room on their radios. So they can call in stroke alerts. They can call in trauma alerts. They can do those things. And that's another thing, you know, that I'm really proud of, that we've worked really hard. And if you don't have the collaboration with those fire chiefs and that fire administration, you're not going to see this. But those guys come and they train and with us every quarter. And so they work under our same medical protocols. So they know how to do an assessment just like our EMS personnel. And it's, you know, just because they work for a different agency, the level of care that you're getting on scene is the same.
That's powerful.
Yeah, that's phenomenal. I mean, to think that all of our first responders in our communities have that type of education and that they're all working together has to make a difference in quality of care ultimately being delivered.
And speaking of our cardiac emergencies, we recently launched our Heart Ready program.
Yes.
So can you talk a little bit about that and how it's preparing other community members for knowing about heart emergencies?
Yeah, so we have a Jumpstart a Heart through our SGMC Health Foundation. And any organization, civic organizations or public safety agencies can apply through that grant for AEDs. But what we've really seen is an uptick in our civic organizations and our churches and other people in the community that are requesting those AEDs. So we're able to provide those AEDs, take it there, and provide the training. Anybody can use an AED. You see them when you go to the grocery store, when you go to the mall, the movie theater, and they're so simple to use. Like you just open them up and it tells you what to do, but it will save a life. You know, when you're calling an ambulance and an ambulance is 20 minutes away and someone's suffering a cardiac arrest, that AED may save their life. The quicker that you can defibrillate the patient, the higher the survival rate. So we're really excited about that program. I'm excited to put it in places like churches and other buildings and organizations, and we provide them with something to put on the outside of their building, their window or whatever, to let us know that, you know, they have an AED in the building. So that's a great program. We actually just provided 2 AEDs to 2 churches over in Thomasville yesterday. We have another one coming up for a business down in Lake Park that we'll be able to put there. That's a business inside a little shopping center. So we're seeing these AEDs all over our community, and that's great. That's
because it's extending your first responders, right? I mean, our first responders take time to get there, but it empowers the community members to, as soon as they see something, be able to recognize what it is and take action.
Yes.
To provide another link in that treatment train.
And your team will also provide like CPR training if that's requested as a part of the program too, not just AED training? Absolutely.
We have a lot of BLS or first aid instructors, and so depending on the organization, we can provide the AHA first aid certification, or we can do the basic life support where we do the CPR certification as well. We can do either one based on what they ask, but we always provide a little bit of hands-only CPR instruction whenever we give out the AEDs, so people will kind of know what to do and feel empowered to do that. But our 911 dispatch also, if you call, they'll walk you through that. So they can teach you how to do CPR when you call 911. Mm-hmm. They provide those instructions.
What's your go-to song to keep you on beat when you're performing CPR?
I don't sing. I can't.
Okay.
And that's just because
That's
guess I'm so OCD. But they say this new Ella Langley song you can
he's
choose in Texas.
Yeah,
so I like that song. So I may start using it next time.
That was just,
That's all over the social media
It
for
is.
the American
It
Heart
is.
Association.
Yeah,
Every time there's a new song out there, like, oh, this one is to the beat of what you need.
Yeah,
for
she's the new
CPR.
big deal. And so I saw that the other
Yes.
day on like TikTok or something. So I may use that next time.
all right. Your team has earned Safe Ride Champions. What does that mean?
So we have special systems that we carry in every ambulance, and it is based on the size and the weight of the child, but it is custom to their size that we can place on our stretcher so that we can bring them in and they are restrained properly on the way to the hospital. It's not safe to secure a car seat to the stretcher. Some of our ambulances have a seat where you can properly secure the car seat if you need to. But a lot of these patients, we need them to be laying on the stretcher so that we can assess them properly and get vital signs, things like that. So these systems allow us to be able to do that for kids, babies, even, as 5 or 6 pound babies, if possible, if we need to. So we can do that safely. That's a big deal. That's
I've never really
huge.
thought about that, about transporting children and the difference and
Sure.
what you would need for that.
If you look at a small child and you put them on that stretcher, it's not just using the regular straps. It's not going to secure them properly. And that's a big thing. I mean, I think we've seen that push over the last several years about car seat. We have several car seat technicians within our organization, and we try to teach that to the community. So we, too, should be responsible for transporting them safely. An emergency doesn't negate safe transport. So,
For sure.
You helped implement a cadet program for EMTs, right?
yes.
And other workforce initiatives. What problem is that solving for us to have our own cadet program?
So I think recruitment and retention over EMS in general is just such a difficult and complex issue. The number of licensed personnel in the state of Georgia, we see that, especially in our region, trend down a little bit every year. And so we have a lot of paramedics and EMTs that are aging out and not renewing their license. And then, when you're not replacing them, you're going to have a recruitment and a retention issue. So we wanted to start that cadet program so that we could bring people into the EMS profession. We hire them, and they're our employees while they go. So we pay them as they learn, and they complete the EMT basic program. We pay for them to take the registry and get their state license. And then they work a year on our specialty care transport division side, doing interfacility transports. During that year, we will help them go back to the advanced EMT program if they want to. And we teach that program in-house, or we utilize Wiregrass's program for both of those. And then once they complete that, they're able to transfer over to the 911 side. So we've seen through our cadet program, the very first one, we still have people that completed that program that are still in our agency, and we've watched them filtrate through from the specialty care transport side to the 911 side. In fact, we just had our awards banquet this year for EMS Week, and the paramedic of the year, he started in our first cadet program. He was one of the students there just a couple of months after he graduated high school, and so he has, during that time, went to Wiregrass's advanced program, went through their paramedic program, and he's been working on our 911 side, I think, since maybe November or December of last year, and doing really well, obviously. So he's paramedic of the year. So we're seeing that work, and we're seeing we have several people that were in that class that are still within our agency and have come over to the 911 side. Some stayed in the specialty care transport division, and that's, we need personnel for both. So we're excited about that program. We have another class that we think will be coming up in August so that we can start replacing the ones. We've got 5 or 6 in the advanced program right now that they're going through, and then we've got 4 or 5 that will be in the paramedic program in the fall at Wiregrass. So we're excited about that. We hope that this continues to staff our 911 division and they can.
Speaking
do
of the
good things.
awards ceremony, what other awards did they give out? I know there's certain like things that they can achieve as paramedic, like life safety awards. Tell us a little bit about what those look like.
We present cardiac pre-save awards, and so the criteria for that is that if the patient's in cardiac arrest on scene, that they have to get a pulse back before they get back to the hospital, and that the patient has to either be transferred out of our emergency room or go to our ICU still alive for them to get that award. And then trauma saves, they have to receive some kind of life-saving treatment on scene and then come to our hospital and need to go to the operating room, and they have to be discharged from the hospital alive. So we handed out 160 of those awards combined. And then we also recognize our EMT of the year, which was Scott Roberts this year, and that's that award and the Paramedic of the Year award is peer voted. So they vote, the peers vote on those two awards. And then we award a Robert Mitchell, who was a past captain here for us at SGMC EMS. We give a Robert Mitchell Leadership Award, and EMS admin decides on that. And that this year, that was Captain Benny Sadler from our Brooks County Division.
Very good.
Awesome.
It's always fun to be able to recognize the work that they're doing because truly they are on the front lines out in our community serving our patients. So
And
we
sometimes
don't want them to
probably,
be overlooked.
probably feels like a thankless job too because someone's not thanking you or they're at their worst.
Very much, very much so. And our community, I think, does a good job of. I get people that probably several times a month that call back or email me or see me somewhere and talk about the great care they receive. So I'm proud of that. Our personnel work hard, to be able to be recognized, and I think our community does a good job of doing that. So you don't see that everywhere, and we have a good community that appreciates the service that we provide, I think.
If there was any kind of advice you could give to the community regarding calling 911, when to, or just any myths, just what's the number one thing you would want someone listening to understand or just learn about EMS today?
Everything's not an emergency, even though it feels like it is. But we're coming, and we're coming safely, right? So if you call in and it's something that's not emergent, we're not coming lights and sirens to your house. That's dangerous for us. It's dangerous for other people on the road. So we're coming to assess you, but we may not come like it looks like on TV every time somebody calls 911. And then, for true emergencies, obviously, we're coming as safely as we can and as quickly as we can. But I think it's probably a widespread issue of overutilization of 911 in the emergency rooms. So I think that's something that your hospital systems are not always able to address. I think there's a lot of, socioeconomic issues that go along with that. And probably the person calling 911 doesn't always believe they have an emergency, but that is their only pathway to healthcare. And that's the only way they can get in, to see somebody for healthcare. So I think it's really complex, and I think your groups need to come alongside your healthcare organizations to help address some of that. But it's pretty a complex issue. I wish I had an answer for it.
I know. Looking ahead a little bit to our new ER and trauma center that's going to be done here at the end of 2026. I know we're all so excited, but what does that mean for your team and for EMS?
I think it's just a lot more efficiency. I think that obviously we need the space. We need the extra beds just from volume increases. So that's going to help us tremendously. I'm most excited about being able to drive the ambulance in and not have to back it up. And then you can just drive in and turn around and drive back out. And that's going to be great for me.
Traffic flow.
Yes,
control.
The traffic flow is going to be great. I think just the space overall, I think it's just something that the community can be proud of. It just shows that we're still investing in emergency care and growing, and that's important to us. And so we're excited about the new space and just being able to kind of spread out a little bit. Everything won't be sitting up under.
You can really see that ambulance bay taking place right now.
Yes, I'm excited about that.
Well, is there anything else you want to share with us this morning? No.
Oh, I know a question that I get sometimes is people want to know why we're a level 3 trauma center as compared to a level 2 or a level 1. Can you explain what the difference is between the levels and why we are a level 3?
We operate really along the same lines as a level 2. There are just a couple of subspecialties that kind of separate us from a level 2, and that would be some of your lesser utilized subspecialties, like your maxillofacial, maybe some of your interventional radiology, things like that you have to have continuous coverage of to be a level 2 trauma center. And so we don't always have that kind of coverage, but as far as cardiothoracic, vascular, orthopedic care, we operate a lot and see the same things at a level 2. Our volumes are that of a level 2 trauma center. And I think that that's potentially a goal, that we'll set in the next several years as we continue to recruit physicians and continue to build our organization and health system. Level 1s are going to be, that's your academic centers. That's where you have to have research, and you're really going to see that more at a university level, like a teaching hospital. So that's your Gainesvilles and your Emory's, Grady's, that sort of thing. And that's really what separates a level 1 from a level 2. There are some volume guidelines that you have to meet, like you have to admit over a certain number of patients a year to be a level 2. But the biggest thing is going to be the research and just the teaching hospital overall. They have all the residents and that you can think of, the surgical residents and things like that. So that's the biggest difference.
Yeah.
And as far as trauma prevention, just speaking because we have members of just the general public that listen to this podcast, what's the number one thing that someone can do to prevent coming to the ER? Wear your seatbelt.
Wear your seatbelt.
Don't get
Don't
on the
ride a
ladder.
motorcycle.
Wear your helmets. Pay attention to because you have to pay attention to the cars. If you're going to ride a motorcycle, they're not going to pay attention to you. Be safe. Do not let your children ride golf carts stacked 10 deep on the golf cart without being seat belted in. If you're under the age of 16, you shouldn't be driving it. Don't drive it on the roads. Drive it safely. We're coming up on summer, so we'll see an uptick in that. That's just irresponsible to let 8 or 10 children on a golf cart ride around a neighborhood. We see that every year where they flip the golf carts, where they're just riding around subdivisions and things like that, where you see golf carts a lot, but there's a way to do that safely.
Well, I think it's easy to get complacent too when you haven't experienced an accident or an injury from that, but you see those every single day in our ER. So it is one of those things where it can happen to you. So to prevent that is important.
Yes.
I do have a question I know the entire community wants to know. Has there been an uptick in traffic accidents at the roundabouts?
No, there hasn't actually. I'm surprised.
At the new roundabouts we built.
I think those guys at the furniture store really helped us out with that throughout the community by educating and everybody wanted to score a 10, so they were trying to do really good. They probably went home and researched how to drive in a roundabout, but there really hasn't. We've had a couple, but it hadn't been bad.
Also, you're going slower naturally,
Right.
so even if you were to get into an accident, it's not going to be a really bad one.
I feel like people are slowing down because they have it to the little one lane still, and people are just going slower, so you have more time to react. When they open it all up, I'm not sure that we won't see a little uptick. We'll keep our eye on it, but so far it has not been what I imagined it would be.
Well, very
That's good.
I did see the ambulance go through the roundabout on the furniture store's video, and they scored
we got a
10.
10.
They
We got a
good.
10.
Yes. So.
That was our EMT of the year right there.
Okay, there we go. See? All right. Well, I think that wraps us up.
Yeah. We don't even have to ask you your favorite food question because we've already done that.
Has it
That's
changed?
right.
Unless it's changed.
I don't eat over there much anymore since I moved my office.
Yeah.
But you can never beat their breakfast. Their breakfast is the best.
Yeah. All right. Well, thank you for joining us. We
Yes.
really appreciate it.
A lot going on in your world, and we appreciate all you do to make sure that our first responders and our trauma program is where it needs to be to take care of everybody.
I certainly feel like we're in safe hands.
Thank you.
All right. Until next time.